Today we're going to discuss about ulcer of a specific type, that is varicose ulcer or venous ulcer. So what is a venous ulcer or a varicose ulcer? It is an ulcer which develops in the lower leg as a complication of varicose vein or deep vein thrombosis. The common site is in and around the medial malleolus, known as the gaiters area. The etiopathology of the varicose ulcer. Ambulatory venous hypertension is now understood to be the primary cause responsible for the formation of venous ulcer. There is two theories which have been suggested for the pathogenesis. We have the fibrin cuff theory and the white cell trapping theory. So the fibrin cuff theory. So as an onset to the varicose vein, we have incompetence of the venous valves, which results in stasis of the blood or accumulation of blood, and this results in the chronic ambulatory venous hypertension, which causes defective microcirculation. Thereby the red blood cells diffuse into the tissue planes. Then there is RBC lysis, release of hemosiderin, which is responsible for the pigmentation and later dermatitis. Capillary endothelial damage results in prevention of diffusion and exchange of nutrients, and this results in severe anoxia, following which there is chronic venous ulceration. So this is the fibrin cuff theory, right from the onset of venous disease to the pigmentation, dermatitis, and later the anoxia and venous ulceration. Alternatively, we have the second theory known as the white cell trapping theory. Here also the white cells adhere to the endothelium of the capillaries as a result of venous hypertension. There is inappropriate activation of trapped WBC. This is followed by release of proteolytic enzymes, which leads to tissue destruction and ulceration. So here also, from the onset of venous disease to ambulatory venous hypertension, and then white cells getting trapped with activation of the WBC and release of the proteolytic enzymes, and thereby tissue destruction and ulceration. Now, a few words regarding the clinical features of venous ulcer. The ulcer commonly develops in the gaiters area, that is the area above and around the medial malleolus. The ulcer is tender and usually non-healing and tends to recur, especially when associated with secondary infection. There is usually surrounding pigmentation, eczema, lipodermatosclerosis, and scarring. This is already understood from the pathogenesis. Dilated tortuous veins will be seen in the affected limb. So here you can see the dilated veins above, the discoloration, the lipodermatosclerosis, and we have an ulceration over here. This is another person. You can see the entire tortuous dilated varicose veins in the limb, and the ulcer will be seen near the ankle region. So in case of long-standing or chronic ulcers, it may undergo transformation into a squamous cell carcinoma, in which case it is known as a Marjolins ulcer. Similarly, long-standing ulcers may result in ankylosis or periostitis. Then the patient may tend to walk on toes to relieve the pain, leading to a deformity known as the talipes equinovarus deformity, that is the horse leg-like deformity. The complications associated with the varicose ulcer, we can have hemorrhage or bleeding, infection, the talipes equinovarus, periostitis, Marjolins ulcer, and eventually disability. Investigations: as a regular ulcer, the discharge from the ulcer can be sent for culture and sensitivity study for proper antibiotic selection. The X-ray of the affected part can be taken to rule out bony disease or periostitis. In the case of long-standing varicose ulcer, a wedge biopsy or an edge biopsy can be done to rule out Marjolins ulcer. A venous Doppler ultrasound or a duplex scan is done to assess the varicose veins, that is to assess the saphenofemoral junction, saphenopurporeal junction, the perforator status, and to rule out deep vein thrombosis. Now, in the case of ulcers in the foot, An arterial Doppler ultrasound can also be done to rule out arterial disease or ischemic disease. Routine blood tests will include the complete blood count, fasting blood sugar, postprandial blood sugar to assess the diabetes. Now, a few words about the treatment. The management line is conservative. So, classically, most hospitals follow the Biscard method or Biscard regimen to treat the varicose ulcers. The method promotes ulcer healing by reducing the edema and increasing the venous drainage. It includes patient education, adequate rest, and elevation of the foot or the lower limb, compression therapy, ulcer dressing, and massaging of the lower leg in elevation, especially the calf muscles. Then exercises to the lower leg or ankle region. So, Biscard method classically involves massaging and exercise and compression therapy. Briefly, in simple words, it includes compression therapy, exercise, and massaging to the lower limb. So, a few words about the dressing and compression bandaging. The ulcer requires regular cleaning and dressing. Some recommend dressing with Usol, that is a particular solution known as the Edinburgh University solution of lime, which helps in wound healing. Then, regarding the bandaging, we can do the elastic crepe bandaging to the lower leg. Alternatively, you can go for 4-layer bandaging or graduated compression stockings along with the ulcer care. Regarding exercises, what is recommended is passive movements to maintain the mobility of the foot and the ankle, and active movements of the calf muscle to strengthen the calf muscles. Antibiotics can be given as per the culture and sensitivity report. Once the ulcer begins to granulate, a split skin grafting can be done. The patient must be advised about proper walking. So the patient must be trained to walk with the heel touching the ground first. This is the management in general about the ulcer. Now, while the ulcer is fully granulating and healed, a definitive management can be advised for the varicose veins. A Trendelenburg operation with multiple perforated ligation can be done. Alternatively, minimally invasive procedures like endovenous laser ablation, radiofrequency ablation, along with injection sclerotherapy or hook phlebectomy can be recommended to treat the varicose vein. Thank you.